Hi, my name's Tricia Buice. I am going to do a physical assessment on my patient. This is for Introduction to Physical Assessments at Columbus State University. First thing I'm going to do is introduce myself to the patient. Hi, my name's Tricia. I'm going to be doing a physical assessment on you. Let me go wash my hands first. You gotta follow me. Oh, you don't have to follow me.
Can I stop it?
No, we're keeping going. 22-year-old female, no previous medical history, no complaints at this time. First, we're going to inspect your skin. So I'm going to look all over your skin and touch it. Look at your abdomen. And let me look at your back. Okay. Skin is nice, tan color throughout. Little ecchymotic area noted down at the bottom left leg. It's nice and warm to touch, dry. Turgor is good. Turgor and mobility are good. I'm going to look at your head and scalp now. Her hair is nice and blonde. Clean. No dandruff noted. Hair is evenly distributed throughout the head. No masses or lesions noted. Nails are nice and well groomed, clean. Pink undertones, flat, they lie flat on the bed, and no clubbing noted. And cap refill is less than 3. Okay, gonna look at your face. The face is nice and symmetric. Eyes, ears, nose, and mouth are in its spot that it needs to be in. I'm gonna palpate the temporal arteries. And it's nice and smooth. I'm going to listen to it. Of course, I have no bell on mine, so we're going to have to listen without the bell. No bruise noted. Going to look at the neck, and we're going to test for range of motion. So I'm going to need you to turn your head to the left, to the right, and then I want you to take your head and turn your ear to your shoulder. And the other way. Okay, that looks good. Good range of motion. We're going to look at your mouth. I want you to open your mouth and move your jaw side to side. Open and close. Okay, TMJ is good. No clicking noted. I'm going to look at your trachea, and I'm going to feel it. So I'm going to start down here. Feel the tracheal rings, the hyoid bone is intact, and everything's movable. We are going to inspect the thyroid now. And I need you to turn your chin down a little bit, not that much right there. It's going to feel a little uncomfortable. Thyroid feels no masses are noted. Tracheal is nice and midline. I'm going to assess her lymph nodes now. Make sure there's. So, okay. This is preauricular, postauricular, occipital, retropharyngeal, submaxillary, and substernal. And then these are the superficial cervical chain, and then the deep cervical chain, and the subclavicular. Okay, and there's no the lymph nodes are nice and flat, cannot be palpable. I'm going to look at your eyes now, and we're going to do a few tests to check the movement, the visual fields, and your sight. So these tests are going to be confrontation, accommodation, pupillary reflex, and what they call the H test. So first I'm just going to look and make sure your conjunctiva are nice and white, pink, no redness noted, no drainage noted from her eyes. And then we're going to do the confrontation test. Okay, turn and just sit facing me. Okay, I want you to put this over your one eye like this, same eye that I'm doing, or actually that eye. And then I'm going to put some object out here, and when you can see it in your peripheral vision, I want you to say now. No. Okay. No. Okay. No. Okay. All right. No. 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 Okay. All right. Next one we're going to do is we're going to do accommodation. And what I need you to do is I need you to stare away from me, like at the wall over there. No. Face me. Sorry. And I want you to take your eyes and stare away from me. Okay. And then I want you to bring it back and stare at the light. Stare away. Bring it back, stare at the light. Okay. One eye. Stare away. Bring it back, stare at the light. Okay. Stare away. Bring it back, stare at the light. Okay. All right. Good. Pupillary reaction. Accommodation is good. Confrontation is also good. We're going to do what we call the H test, and that's going to test the movement of your eye. So, okay. All right, good ocular movement. These tests also are tests that can be used to test the cranial nerves, the trochlear nerve, abducent nerve, and the ocular motor nerves. Next thing we're going to do is the Snellen test, and we're going to test her vision. So I've put the test over here, and she's going to stand over there, which is 20 feet. And you can just put your hand over your right eye and look at this scale. Okay, can you read this line right here.
EDFOZP.
Okay. Can you read this line right here?
FELOPZD.
And can you read this line right here?
DEFPOTEO.
Okay. Now cover your other eye. And can you read this line right here?
EDFOZP. FELOPZD. DEFPOTEO.
Okay. Perfect. 20/20 vision. All right. Now I have a test for the nearsighted vision, and here's the card. If you could come sit down and look at that. All right. So it's got to be about 16 inches away from your face. Let's see. That's this far. Sorry. So you can bring it up a little bit. All right. So can you read this line right here?
This one?
Yeah, can you read that one?
Yeah.
Okay.
LGPF. HEDOT.
No. Try the one above it.
DZECLPTOP.
Okay. Good, good. Other eye?
DZECLPTOP.
Okay. And can you read this line with that other eye?
LGPFZEDOT.
Okay. So your left eye has 16/20 vision and your right eye has 16/24. All right. And that test also is a test that you would use with your optic cranial nerve. We're going to inspect your ears now. So they are bilateral, even, clean. Earring noted in the right upper ear, and let's see, there's 2 holes, earring holes on, 2 on the right and 3 on the left over here. Okay, ear canals are patent, external auditory canals are patent, no drainage noted. No palpable masses noted. We're going to do what they call is a whisper test, and it is to test the vestibular cochlear nerve. So I'm going to whisper something in one ear, and you repeat. Apple. Paper. Okay. So that nerve is intact.